to the mic, okay. I'm usually a podium hugger anyways. Good morning, everyone, and really appreciate you, Senator Johnson, for hosting us today. And I really want to thank all of our speakers, especially the vaccine injured, because you are showing us your vulnerability and your courage, and you inspire me at least. My name is Linda Wastella. I'm a professor. I'm trained in pharmacy, public health, and health policy. I teach and conduct research at the University of Maryland School of Pharmacy, and my views are my own. Before I tell you a little bit about myself, and then how the very credentialed scientists and clinicians came together, I want to describe the format for today. You are going to hear testimonies from two kinds of people. You're going to hear from the experts, the clinicians, the scientists, the lawyers, the patient advocates, and more importantly, you're going to hear from the vaccine injured. You're going to hear very powerful testimonies about their experiences. I would characterize myself. Okay, thank you. Okay, closer. I would characterize myself as a successful mainstream researcher. I have a 30-year career. I have tenure. I've won awards. I've gotten big grants. I've published in big journals. I've devoted my professional life to using research to understand and improve access to pharmaceuticals to better the health of the populations, especially those vulnerable populations. Speaking today is profoundly uncomfortable for me. I prefer the quieter life of an academic. I'm not a media personality, and opposing public health policies is not something I ever imagined myself doing. But here I am, all because of a single announcement this past spring mandating all students, staff, and faculty at my school system to get vaccinated before returning to campus this fall. The announcement chilled me on a personal level, as the mandate impacted not only myself, but my two college kids, one of whom has a lot of medical conditions. It also concerned me on a professional level. How can a university system mandate an as yet unapproved product whose potential harms were still being studied? I reached out to colleagues, discovered I was not alone. This past June, a group of us, scientists, clinicians, and advocates, we filed a citizen petition to the Food and Drug Administration to express our concerns about the rapid mass rollout of vaccines, which were not yet approved. We dubbed ourselves CALM, the Coalition Advocating for Adequately Licensed Medicines. In our petition, we didn't ask the Food and Drug Administration to pull the vaccines from the market. Rather, we outlined open questions about them that must be answered before granting vaccines full approval. We focused on emerging and unknown safety concerns impacting the general population, but as well as what we considered at-risk groups for vaccine problems, including children and adolescents, previously infected persons, and pregnant and nursing women. FDA denied our petition the same day it approved Pfizer's vaccine. And now, not only do we not have answers to our questions, but we have expanded mandates affecting federal and defense employees, private businesses, healthcare workers, universities, and public school systems, among others. We still know nothing, absolutely nothing, about long-term vaccine harms because the vaccines haven't been out that long. Indeed, 20 months in, we barely understand immediate harms from the vaccines. How can we possibly provide informed consent without this information? So today we stand or sit before you as individuals, and I want to reiterate, we are not an organization. Indeed, we are the epitome of grassroots. This all came together through word of mouth. And to be clear, absolutely clear, we are not opposed to vaccines. Rather, we oppose their mandated use. We are citizens who have done our civic duty, but when we experience serious adverse effects, we're left high and dry by FDA, CDC, the NIH, and medical professionals. We are scientists alarmed by the toxic environment in academia and scientific publishing. We are military leaders concerned about vaccine safety in the armed services. We are clinicians who want to treat patients harmed by vaccines, but whose practices are limited by their employers and professional boards. And we are lawyers and patient advocates seeking help for our injured clients and their families. We are the people you haven't heard from. And we have nothing, absolutely nothing, to personally gain from being here. Indeed, We have everything to lose, including our jobs, our titles, our livelihoods. But we don't intend to go away until we see some real change. Please understand, this is not a compromise to decide which is worse, the disease or the vaccine. Such a premise is myopic and ignores the people who serve the public's health and now require care they've yet to receive. I hope, we can all agree adverse events that disable and kill are not acceptable outcomes. I do believe we can do both. Provide vaccination, access to those who choose to be vaccinated, and we can assess the safety of these products in a rigorous and thorough fashion in order to provide safer treatments and protocols. Today, let's forget the tribes. Let's forget left versus right, red versus blue, politically correct versus politically incorrect. Let's forget vaxxed versus unvaxxed. We just ask that you listen. We aim to challenge the perspectives and things you believe to be true. In turn, we ask for you to challenge us. Thank you.